Let's talk about selank. Selank is a peptide like many other peptides that was developed in Russia as a nootropic drug, and it was developed to treat anxiety and depression orders. And as always, this is not medical advice. This is for educational and research purposes only. So selank consists of 7 amino acids, also known as a heptapeptide. Selank is an analog of tustin, which is a naturally occurring peptide that is found in the spleen that helps with immune function. In 2009, it was approved in Russia and Ukraine to treat GAD, or generalized anxiety disorder. And selank exerts its effects mostly through the central nervous system and through the immune system. One of its many mechanisms of action is that it upregulates GABA receptor expression. It also increases BDNF, which is brain-derived neurotrophic factor, and it also increases NGF, which is nerve growth factor. It also rapidly alters serotonin metabolism in your brain, typically within 1 to 3 minutes of administration. And even though the half-life of selank is only a few minutes, a lot of its metabolites still hang around and do their job. Selank in Russia was mostly studied as a nasal spray, and nasal sprays typically have anywhere around 70 to 80% of bioavailability. But most of the time in the States, you're going to see it over here as a lyophilized powder for subcutaneous injection. But it is possible to make this into a nasal spray. Now, selank was developed to treat mild to moderate cases of anxiety and depression, and it might not work for everybody. But they are a much safer alternative to SSRIs. If anxiety and depression are some of the things that you might be struggling with, it might be worth your time to look into more research on selank. Because as I said earlier, the safety profile of selank is much safer than benzodiazepines. As always consult your doctor before you do anything. Thanks for watching, guys.